Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 45 of the Ask Dr. Angela podcast. First of all, I just have to say, I cannot believe that we are on episode 45. I know that that's not like a major number. You know, we usually go with like episode 50, 100, 200, things like that. But we are really just doing the damn thing. I'm so excited at the amount of support that we are getting, fielding questions from all over the place. I'm getting emails from people in London. The Philippines seems to be a pretty strong spot for questions for the podcast. And I'm just getting a lot of love and hits from, various outlets. I just actually finished doing a contribution for an online publication. Once that goes to press, I certainly will keep you all abroad of that. So I'm just really, really, really enjoying this. So today, I feel like I was running a special on painful intercourse. I saw both young and old folks alike that came to me and they're like, oh my gosh, it hurts when I have sex. So what to do? How to treat it. So one of the first things that I ask women when they come to me talking about painful intercourse is, what's painful about it? Is it painful with insertion? Is it painful with deep penetration? Is it associated with various positions? Is this new or has this been going on for a long time? Another really big question is, are you adequately lubricated? Because hello, if you're rubbing two things together that are dry, it's going to get hot and it is not going to feel good. So are you adequately lubricated? The other thing that commonly comes to mind is, are you having any weird, funky, foul-smelling discharge? I'm basically eliciting signs for any type of infection. Any underlying infection certainly might contribute to intercourse that is not so fun. We don't want to be transferring back and forth gifts that keep on giving, and you can read between the lines on that. But once we rule out all of those things, certainly things like infection, adequate lubrication, positions, and any other symptoms, recent abdominal pain, perhaps there may be something going on in the pelvis, like an ovarian cyst or something that could be contributing to painful intercourse. Part of the workup may also include some sort of imaging to take a look at the uterus and the ovaries. Cultures probably will be obtained if there's any complaint of any discharge. Asking questions about things like stress is also very important. We don't realize the effect that mental issues or the mind can have with regards to intercourse. If you're not in the right space mentally, sex is just not going to be fun, and it might even be painful. With regards to my elderly population, who typically deal with issues of atrophy, and that's just lack of estrogen affecting the vagina. And we've talked about this before. When you're in menopause, the whole architecture of the vagina completely changes. The vagina is no longer supple. It's no longer moist. The mucosa or tissue becomes thinner, drier. It loses its ability to accommodate. The vagina doesn't look like an accordion anymore. It looks like just a plain light pink tube with no folds. So again, the ability to accommodate, being dry, all a lack of no estrogen, which is, it happens in menopause. So if atrophy is the major issue that we're dealing with in my older population, certainly we want to try to treat that. You can treat that with vaginal estrogen, and that comes in many forms: a ring, a pill, a cream. You can try vaginal moisturizers, which include things like Replens, Luvena. And the old saying, If you don't use it, you lose it, right? Yeah, if you don't use it, you lose it. Vaginas that haven't been used in a long time, sometimes we need to train them to get them kind of back in shape. And so sometimes I send my patients to, those specialty stores, get some vaginal dilators, and slowly but surely, you can kind of rejuvenate your vagina, your vajayjays, if you will. So I hope that I've answered your question. I've kind of talked about a lot of different things to consider, but hopefully some of these things will be helpful in trying to get to the bottom of why you might be having painful intercourse. And let's not forget those essential oils, i.e. olive oil and coconut oil, which are great for the vagina. Pasta, anyone? Anyway, that's a really terrible joke. But hopefully this podcast has imparted some knowledge and will be a stepping stone to have a conversation with your OBGYN partner or whoever about exactly what's going on. Thank you so much for tuning into this episode of Ask Dr. Angela. If you have a topic or a question that you would like to submit and have featured on the podcast, please go to www.askdrangela.com. That's AskDrangela.com. Just click on the microphone on the right-hand side of the page and do what you do. In closing, I'd like to leave you with this saying from Lao Tzu. Time is a created thing. To say, I don't have time, is to say, I don't want to. No excuses, people. Let's just get it done. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 46 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.